I have 11:01. I think we're good to go ahead and get started. Again, this is March 4th, the Substance Use Response Working Group's Response Subcommittee that we'll call to order. And we'll start by taking roll call. Crystal.
Good morning, Crystal Duarte for the record. We have Dr. Shayla Holmes.
Present.
Dr. Terry Kearns.
Present.
Nancy Lindler.
Present.
Christine Payson. Senator Jeff Stone. Okay, I would just note that all members serving in the Nevada State Legislature are removed through from quorum requirements for the duration of the session. So we do have a quorum, and I would also note Christine Payson has now entered the meeting.
Great. So we
Morning,
have
Christine.
Morning.
Hi, Christine. So we do have our membership excluding Senator Stone, who is not required to be here because of legislation. So we will move on to the next agenda item, which is public comment for agenda item 2. For public comment will be received via Zoom by raising your hand or unmuting yourself when asked for public comment. Public comment shall be limited to 3 minutes per person. This is a period devoted to comments by the general public, if any, and discussion of those comments. No action may be taken upon a matter raised during a period devoted to comments by the general public until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241.020. If you are dialing in from a phone, dial 669-444-9171. And when prompted, enter the meeting ID 868-3331-1069, and then press *6 so the host can unmute you. Do we have anyone for public comment? Give it just a minute in case somebody's trying to get off of mute. And I would add, we will have a public comment session at the end of the meeting as well.
Dr. Kearns, this is Crystal Duarte for the record. I don't see anybody coming off of mute or raising their hands. I just wanted to note, as we give that 1 more minute, please do not use the chat for public comment or any communication. That will be part of the public record.
Thank you for that. Okay, we'll go ahead and move on, not hearing or seeing anyone for public comment. And as I noted, we will have that opportunity open again at the end of the meeting. For agenda item 3, we will review and approve the November 5th, 2024 response subcommittee meeting minutes, which seems like a long time ago since we've had our subcommittee meeting. So if there's any discussion or if someone would like to make a motion to approve those minutes, I'll take that.
Christine Payson, I'll move to approve.
Thank you.
Second.
Great. So Christine Payson makes the movement and Shayla Holmes seconds it. At this point, we'll vote on that. All members who approve the minutes, say aye.
Aye.
Aye. Any opposed? Any abstentions? Okay, so our November 5th, 2024 response subcommittee meeting minutes are approved. We will move on to agenda item number 4. Because our last meeting was in November of 2024, we wanted to do a subcommittee reorientation for all of the members and just go through and highlight a couple of things. Again, just to reorient the meetings. We'll talk about the attendance. As everyone remembers, since March of 2024, attendance has been tracked. And any member who goes below that 75% attendance rate would for the subcommittee or the SURG working group would be asked if they wish to continue serving. And if you cannot attend a meeting, if you would please email SCI staff at least 4 business days in advance to ensure that we have a quorum, or if we need to reschedule the meeting. And I would highlight, even if it is a excused attendance, it still does count against the attendance. Any comments or discussion from anyone about the attendance requirement that comes straight from the bylaws? Okay, hearing none, we'll go ahead and move on to the next item. For our recommendation process, as you will remember, last year we took recommendations either in the meetings, or you could provide recommendations through a survey in SurveyMonkey. And the earlier that we get recommendations, the more time we have to schedule for presentations and to refine those. So please submit any of your ideas as early as possible. And I would say, even if it's not a fully vetted recommendation, if it's just kind of a thought, submit that, because that would give us time as well to really work those recommendations as well. And we recommend all subcommittee members are encouraged to submit at least 1 recommendation. And at this point, are there any questions on the process that we use for our recommendations? I would highlight that I believe that SEI did a survey too, to see if everyone thought what everyone thought about the process we used last year, if it worked well, or if there were changes that anyone would want to make. So I personally thought it worked very well, and we've really refined the process over these years that we've been doing this. So thank you to all the members for your diligence and your participation. Next slide. We do want to go through the AB 374, Section 10, which basically is our requirements and our subpopulations that we need to address within our subcommittee and within the SURG. We'll move on to the next one. If you will remember that our recommendations from 2024, the response subcommittee's first recommendation was about having that getting data sharing agreements with the chief data officer and implementation of a cross-sector database. That was the first one. The second one is supporting that collaborative process for the Fund for Resilient Nevada to conduct wastewater sampling of high schools. As I think everyone remembers, the Fund for Resilient Nevada did fund this proposal that was submitted from UNLV about wastewater surveillance. So that's a plus for us that I think it was funded before our recommendation actually came out. We'll move on to the next recommendation, which is recommendation 3, which has been an ongoing recommendation to resolve that conflict between the Good Samaritan Drug Overdose Act and drug-induced homicide law. And we really refined that to include immediate actions, to include recommending community level education using best practice guidelines, as well as education for law enforcement personnel. And I do believe that some of our prevention coalitions have been doing the community level education, and through CASAT, they have been doing some education for law enforcement. But what was added on to this was exploring options for altering the Good Samaritan language to expand coverage to a greater population of individuals living with substance use disorder. If you'll remember from the discussions we've had, there are still those that may not be calling or are not calling 911 for fear of being arrested. So that is one thing that does continue within our community, as we've heard both to us and that was provided in testimony to various different groups and meetings and legislation. Recommendation number 4, review the operations and lessons learned from the Clark County Regional Opioid Task Force when that body's report is released, and take this into account when supporting legislation to establish regional overdose fatality reviews, but ensuring that those committees are flexible as to the makeup and practice, and for the OFR to remain at the county or regional level. So we did have a presentation in our November meeting from the Clark County Regional Opioid Task Force, and I believe they were going to as well be presenting that to the legislation. And we also added the funding be provided through the Fund for Resilient Nevada to support this recommendation, and additional funding may need to be provided to the coroner's or medical examiner's office for personnel that they cannot use grant funding for. I should say federal grant funding for. We'll move on to the next recommendation. That was number 5, recommend state agencies under the legislative, judicial, and executive branches involved with deflection and diversion programs have a comprehensive definition of recidivism and policies related to measuring and reporting recidivism. Currently, the only one that has that is the Department of Corrections, and that doesn't work for our jails, our county level. So that's something that we've pushed out to different agencies to look at doing. And the Attorney General's office, who also supports these programs, would also need to look at this as well. And the last was to implement a voluntary program to install drug take-back bins in retail pharmacies. So that's our recommendations, as you'll remember from our last session. Again, thanks to all the members for your diligence and your hard work in researching and bringing these recommendations forward or refining them from previous recommendations. We'll move on to the next. And this is really going through now the legislative language and the response subcommittee assignments. So as you'll remember from AB 374 from the 2021 session, section 10, subsection 1 is comprised of components A through Q. And in 2021, guidance from Vice Chair Tolles, Dr. Woodard, and myself, we went through and determined the subcommittee alignment. And if you would like to see more information on the 2024 annual report and those requirements that were addressed in the subcommittees, that's in pages 35 through 55 of our annual report. It kind of gets into the real details and of each of the recommendations. We'll move on now to the next. So in looking at the A through Q, these were the recommendations or the that went to the response subcommittee. As you can see, I believe we have the most as a response subcommittee. D is to work and understand how residents of this state are involved in the criminal justice system, and access supports for treatment and recovery from substance use disorder at various points, including without limitation by reviewing existing diversion, deflection, and reentry programs for such persons. I was to develop strategies for local, state, and federal law enforcement and public health agencies to respond to and prevent overdoses and plans for implementing those strategies. K was recommend strategies to improve coordination between local, state, and federal law enforcement and public health, to enhance the communication of timely and relevant information relating to substance use and reduce duplicative data collection and research. L is evaluate current systems for sharing information between agencies regarding the trafficking and distribution of legal and illegal substances which are associated with substance use disorders, including without limitation heroin, other synthetic and non-synthetic opiates and stimulants. M, study the effects of substance use disorder on the criminal justice system, including without limitation law enforcement agencies and correctional institutions. And study the sources and manufacturers of substances which are associated with substance use disorder, including without limitation heroin, other synthetic and non-synthetic opiates and stimulants, and methods and resources for preventing the manufacture, trafficking, and sale of such substances. O, study the effectiveness of criminal and civil penalties at preventing the misuse of substances and substance use disorder and the manufacture, trafficking, and sale of substances which are associated with substance use disorder, including without limitation heroin, other synthetic and non-synthetic opiates and stimulants. P, evaluate the effects of substance use disorder on the economy of this state. Next slide. And then the cross-cutting assignments from that AB 374 was B, to assess evidence-based strategies for preventing substance use and intervening to stop substance use, including without limitation the use of heroin, other synthetic and non-synthetic opiates and stimulants. Such strategies must include without limitation strategies to help persons at risk of a substance use disorder avoid developing a substance use disorder and discover potentially problematic substance use in a person and intervene before the person develops a substance use disorder. H is to examine qualitative and quantitative data to understand the risk factors that contribute to substance use and the rates of substance use and substance use disorders, focusing on special populations. Q, study, evaluate, and make recommendations to the Department of Health and Human Services concerning the use of money described in section 10.5 of this act to address substance use disorder, with the focus on the use of money described in subsection 1, 2, and 3 of section 10.5 of this act to supplement rather than supplant existing state or local spending. The use of money described in section 10.5 of this act to support programs that use evidence-based interventions. The use of money described in section 10.5 of this act to support programs for the prevention of substance use disorders in youth. And the use of money described in section 10.5 of this act to improve racial equity and reporting by state and local agencies to the public concerning the funding of programs to address substance use, misuse, and substance use disorder. I will say before we get into the next slide that at the hearing for AB 19, where there was a request to increase the membership, I felt very good about the fact that I was able to talk about the structure of the SURG and the subcommittees, which with the 3 subcommittees, and what we address and how we took the legislation and broke it out and assigned those various things to the different subcommittees. So each subcommittee wasn't looking at all A through Q. So I think it really helped to align any fears of the legislators that we may be getting the SURG too large because of the process that's put in place. So again, kudos to all our members for their diligence and hard work in this. I will hand it over to Crystal now to speak to the next slides.
Okay, so the following slides show which of the components of AB 374 this subcommittee's recommendations have addressed. And this is also to say that although you might have addressed something the most number of times, like 9, this isn't always quantity is what we're looking for, right? There's one recommendation related to evaluating current systems for sharing information. It's a very strong recommendation. Maybe only one is needed. So I just wanted to give that caveat because I know sometimes when we look at data, we're sort of looking at like, what is this telling me that we need to do differently? That's for the subcommittee to decide. This is just one way of looking at it. So you can see that this one breaks down the number of recommendations in descending order. So you've had the most recommendations related to developing strategies for prevention of overdose, which makes sense. That's an urgent need. And so that's probably why that's at the top. And then you've had fewer for studying the effects on substance use disorders on the criminal justice system. I have a couple other ways to show the same information. So I'm going to move to the next slide, but please feel free to be tracking questions or ask as they come up. So here's another breakdown on this one. I know it's hard to see. We don't have the actual language of what D through P include, but this also does include how the subcommittee's recommendations have addressed the cross-cutting elements that are assigned to all subcommittees. So with this, we went all the way back to 2022, and the subcommittee submitted recommendations that addressed I and O, and also Q. Then in 2023, it's kind of mixed across these different areas. And remember, one recommendation might have addressed multiple components of the legislation. And then at the bottom, we've noted that some of the recommendations over time through the process have been combined. So response might have submitted something and the person submitting that recommendation noted that it addressed one element within response, and then it got combined with one from prevention, and so it also addressed an element within prevention. These really aren't clear-cut lines between the subcommittees and the components. It's really intended to make a systems change, so these are supposed to be woven together in that way. So that is the recommendations aligned with assignments and cross-cutting assignments. The next slide, I believe, is related to how often certain populations were addressed. I'm just pausing here in case anybody has questions about this.
Crystal, this is Terry. I just wanted to highlight that I really appreciate the work that SEI put in to develop these, because we know what our recommendations are, but to put it in this format really shows what we've addressed, what we needed. For example, in 2024, we didn't have any on L, which I believe was looking at how substance use has affected the state's economy. So that was something we were able to address as we looked at that was evaluate current systems for sharing information between agencies. So I think that helped to guide us, but seeing it in this format to me is really helpful. I guess I could say a data geek, so I really like it. I just wanted to see if there were any comments from the rest of the committee members.
The only comment I would add, this is Shayla Holmes for the record, is that I also find it very useful. It helps sort of direct where some of our research can go. Not to say that, we should only be focused on the ones with smaller numbers, but I think that, that does just help kind of further define what could be a very giant elephant.
Yeah, that's a really good point. And one other comment that I would make is I would say that from 2022 to 2024, I think we refined our process and refined the way that we look at the recommendations. So we might have had more overarching types of recommendations in that 2022 kind of pie in the sky, and we were able to either take old recommendations and refine them down to a more manageable recommendation. And also with, I think, the guidance of some of our legislators, we're able to, really hit areas that make it palatable to them and make it more palatable to be able to read and understand what the recommendation is. If there's no other comments, we can go to the next slide.
So Crystal Duarte again for the record. So this one, this slide looks at the number of times all SURG recommendations aligned with cross-cutting issues. So out of 56 recommendations, 26 were related to evidence-based strategies for preventing substance use. So you see that in B. There's been fewer related to examining qualitative and quantitative data to understand the risk factors that contribute to substance use and the rates of substance use and substance use disorder, focusing on special populations. I think quite a number of them have addressed making recommendations specifically concerning the use of money. So there's 17 there. I'm going to go to the next slide so that we can see the number of times special populations impacted by recommendations. And this one only includes 22, 3, and 24. To Dr. Kern's point, we refined the process, which includes what's getting reported in the annual report. So in 2022, we didn't report the special populations impacted by recommendations. So we weren't able to have that here in this chart. But you can see this one is broken up by subcommittee. And in 2023, for example, this subcommittee had 3 recommendations related to veterans, 3 related to people involved in the criminal justice system, 2 that might impact pregnant women, 2 that might impact lesbian, gay, bisexual, transgender, and 4 that impact people who inject drugs, 1 involving children involved with the child welfare system, And then there's this category where if you scroll all the way to the bottom, the other populations overly impacted by substance use disorders. That's where we have the most across all subcommittees, with 29 people noting that their recommendation addressed that population. In the new version of the online survey, we're asking for more specificity around that, just so we understand what are those other populations that people have in mind when they're making a recommendation. The other thing I would point out just on this one, again, not necessarily saying quantity means that it's better, but children who are involved in the child welfare system has fewer, as do pregnant women and the parents of dependent children. And again, this is, you could select multiple populations. So that's why this number here does not add to that total of 56 that we saw.
Any feedback or comments from the committee members? I have a question for committee members. Is this data that, I've been asked to present the 2024 recommendations. Is this data that would be helpful if you were a member that was getting the presentation? Would you like to see this or no? I thought it was helpful, and I feel like, I will say that I feel like the SURG does get kind of a good feel and good, what's the word I'm looking for? People take it very seriously with the SURG recommendations, because I think they feel like we really look at what we're supposed to be looking at. So for me, this really would help to kind of confirm that.
I would agree with that statement, Terry. And I think that, I don't know. I have a hard time, at least in the recommendations that I've done. Some of them, it's very clear which population it is, and sometimes it's the full gambit. But I think being aware of this is important, because legislation is very clear who our target populations are supposed to be. So I think keeping this at the, forefront, particularly every year when we're at this stage where we're getting ready to do new recommendations, I think it is important to see and be reminded of.
Christine Payson for the record. I agree. I don't know that I would dive deep into this if I was doing a presentation, whether it was for the sheriffs and chiefs or whoever I might be sharing the information with, but it's good to have it if someone asks about the specific populations, to have that to refer to.
Yeah, that's a really good point, Christine. Thank you, Shayla and Christine. Nancy, I thought I saw you come off mute. Were you going to say something or?
Yes, this is Nancy Lemon for the record. It helps me just consider the scope and the impact across all lines that this is involved. That helps me really see how substance use and what these recommendations are to address really impacts all of Nevada one way or another. So it really helps me get out of my own little silo and see the bigger picture.
Yeah, I agree. And again, kudos to SEI for putting this information together. I think it's really important that that we know, and then people that were making the recommendations know that we seriously look at what we're assigned to do and the populations we're supposed to be looking at. I know the other populations impacted by substance use is going to be a difficult one to say, but if we can even dive a little deeper into that, as Crystal mentioned, through having some, I guess, different areas that people could consider. Okay, we'll go on to the next slide. So now we want to get into our planning process for for this year and really looking at what we want to do for this upcoming year. And could you move to the next slide? So as we think about this, committee members, what would the response subcommittee like to accomplish this year? What's our vision for developing recommendations? For example, should we focus on refining last year's or prior recommendations or creating new ones? And where do we want to be by October when the SURG will begin narrowing down the recommendations to include in the annual report? So subcommittee members, any thoughts on any of these questions?
This is Shayla. I think I'm having like a self-realization moment of I'm so bad at, I feel like we do so much work every year. And then when we get to this point, I've like turned off for the last like 2 months. So I'm like, oh no, we did it already. And so I have not been actively engaged at this point in thinking about this conversation. I am curious if it's possible for us to get some updates on where some of our recommendations have gone at maybe our next meeting to see if we want to keep refining them. I think that the outcome of our recommendations is always the measuring stick of like, did it accomplish what we were hoping it would accomplish, or does, I think we make them as best as we make them at the time. And then, but did it do it? So I think there are a couple that it would be really interesting to see where they've gone and if they need refinement. And then, based off of that, maybe it is new, right? If those ones have done what they needed to do, maybe we do just need to keep trudging forward with some innovation.
So if I hear what you're saying, it could be a combination of the two, refining prior recommendations and then also developing new ones if prior recommendations have accomplished what they were meant to accomplish. One thing that I would add, and not a political statement, just trying to have a statement of fact here. There's the potential that our state could get less federal funding this year. So if that is the case, there may be funding going to things that were previously funded federally that now have to be picked up by the state. So that could also really, in my opinion, drive what we want to do with our recommendations as well. So I know, for one example that I've been hearing about is the amount of funding that Medicaid will have is going to decrease. So the state needs to look at where they can pick up that. So that's something that could significantly affect people with substance use, misuse and substance use disorder. Nancy or Christine, do you have any thoughts?
Christine Payson for the record. I just to reiterate, I think it's probably going to be a combination of the two, refining what we've got and then looking at opportunities for new recommendations.
This is Nancy Lemon for the record. I don't have anything to add.
Okay, it sounds like we're all in agreement that we'll have to really kind of get a feel and see what our recommendations. So that would be what I would say when we do our report out at the next meeting. Can we move on to the next slide?
Dr. Prince, if I may, this is for
Yes.
I just had a question, something for the members to be thinking about. Which recommendations would they prioritize getting follow-up information on or tracking? So that we can identify who would be the best person to do that, to bring some information to the subcommittee. A lot of that outreach can take a while to get the on people's calendars. I'm sorry, we don't have a list of all of the recommendations made by the subcommittee over the last 2 years, because you might want to go back farther. But if there's any that are listed here from 2024, that would be great information for staff to have, to reach back to people who might have presented in the past.
Laura, did you have something you wanted to add?
Yes, thank you, Dr. Kearns. The report that went to the full SURG from the Department of Health and Human Services and the SAP people in particular does provide some updates on prior recommendations. So that might be a place to start. And they would be scheduled to give another update again in the next fall.
That's a great point. Thank you.
I think it's, although you moved the slide, Crystal, I think those ones, 1 and 2, if we could figure out if the chief data officer is moving forward, because I know when we heard from them, they were talking about already doing something like this. So our recommendation was aligned with what they were doing. So I think identifying, I think the chief data officer of the state of Nevada for sure would be one to want to follow up with and see, have they made movement here? And is it still a priority and focus for them? And then the wastewater program, because they were funded to do that pilot program at UNR. And I would love to hear if, I mean, they should already be active in collecting this data. And I would love to know if with the data they're collecting, what their findings are, what their, does the cost versus the benefit, is it weighing out? I would love to have a follow-up on that to see if we need to further refine this recommendation to not just support the proposal, but support it for the state or drop it, because I know this has been not necessarily contentious, but one that's had some back and forth. I don't remember what 3, 4, and 5 were on the other page, but these two for sure. And on the conversation, I think following up on last year's, and then if there's that report that Laura was just sharing, perhaps it has some updates on the ones previously. I don't necessarily think we want to go back to the beginning of time. But definitely, last year's, and then perhaps using that other report to see if there's anything else that needs our attention.
Yeah, I think those are all great points. I think too on the number 3, I don't know if anything's been done on that. I know that, the education's been done, but I don't know if anything on exploring altering the Good Sam law, but that might be one to carry forward into the 2027 legislation for if there is specific language, if nobody has done that in the current legislative session. And then for me, 4, I'd like to know, I know Clark County was going to present their report, just see the feedback they got, and if, there's any thought of moving toward having other OFRs throughout the state, whether those are regional or at the county level. Oh, and then number 5, again, I know I've offered within the Attorney General's office to start work on this one, because my thought is if one agency starts it and does it, others will use that as the template. So, and I've not received any feedback. So, that is one, once it might not be ready for the next meeting, but perhaps down the road. And then I think with the voluntary program to install drug take-back bins, that was something we were going to push to the prevention coalitions as well. So I don't know if there's any follow-up from them, if that's been something that's been more amenable because of this recommendation. Any thoughts, Christine or Nancy?
Christine Payson for the record, I would agree with that.
Nancy Lemler for the record, I also agree.
Thank you. So albeit doesn't narrow it a lot, Crystal, it does, I guess, give a little guidance. And these may not all be able to be followed up on at the next meeting.
Thank you. Crystal Duarte for the record. I will start work on following up with different individuals related to these, but also plan at the next meeting that we could bring back the tracking mechanism that Laura started and I believe presented in October to the full surge. So that would be an opportunity to look at prior recommendations and updates that we've received from DHHS on those recommendations.
Yeah, that's a good point. I know we're in the process of all this right now. So I think try to get an update on where we are with our 2024 recommendations. And that will guide us to whether we need to really bring back prior recommendations for refinement or develop new ones. Would that be a good summation, members?
Christine
Nancy
Payson.
Lemler for the record, I agree.
Thank you.
Christine Payson, I also agree.
Ditto.
Okay, that sounds good. And I'm hopeful that as we refine the process, that in October will be similar to where we were last year. And really, it's just, as I like to say, changing words or adding words, such as, you know, changing small dog to puppy or those kinds of things if we need to, but we'll generally be in a good spot for kind of where our recommendations are and what we're going to be doing with them. So next we need to look at topics and presenter suggestions for upcoming meetings. If you remember at the last SURG meeting, this was discussed and there was the topic of interdiction of drugs. That speaker would be to be determined. So I know I have some thoughts on that, and I don't know if Christine has some additional. I was thinking perhaps Haida could provide some background or what they're seeing. Any other thoughts, Christine, on this one for interdiction of drugs? And if you don't have it now, we can get it later.
Yeah, I can get with Keith and see who would be our best option to present that info.
Great, thank you. As you can see, our meeting dates are on here, so you can, if you haven't gotten the calendar invites, you can pencil those in. May 6th, June 3rd, August 5th, September 2nd, and November 4th from 11 to 12:30. And then the overall for the full surge, there was a recommendation of the compassionate overdose response. I know that the SEI staff was going to reach out to Dr. Wagner to see if she had any updates or any additional information to provide on that and where we're at. If anybody else knows of any other speakers, please provide those. You can provide them now or send that information to us in an email.
Chair Kearns, if I may, Crystal Duarte for the record. I actually made a very quick switch. So the PowerPoint version that I sent out to you noted that compassionate overdose response would be presented to the response subcommittee, but actually that will go to the full surge, and Dr. Wagner has confirmed availability to present in April at the full surge. And in April at the full surge, we'll also hopefully get some legislative updates. The Regional Behavioral Health Policy Board directors, I'm not sure, coordinators, will be presenting on their bills. If anybody on this group has been tracking bills, we would also ask that you bring that information to the full surge. We'll get an update on the opioid settlement, annual report dissemination, and then the results of that annual member survey. If you haven't completed it, please do so. It probably takes less than 5 minutes. And then I'm going to turn it back over to Dr. Kearns. Sorry, I just wanted to make sure that that change was noted. because there is discussion of AB 19 at the full surge as well in April.
Yeah, thank you. We also had in addition to what Crystal talked about, the Clark County Regional Opioid Task Force again to see, you know, who they've presented to and any status updates. Then there was one for current trends in substance use for July. And then where we're at with the MOUD in our rural jails, looking at July again. I know that Bill Teal has reported to us on what he's been doing and where he's at with that. Then an update on the crisis response centers that are in Washoe and Clark. I believe both of those have opened. So to get a status update on those, that's again scheduled for July. Then updates from DHHS on status progress of recommendations, which Laura already highlighted for us, which we could look at in October. And one of the things I wanted to update, I know we said to get update on opioid settlement as we've done at all of our meetings. But one of the things I think that we're supposed to get a yearly report from FRN on where they're at. It's not just the opioid litigation settlement and the funding that's come in, but what FRN has done with that funding as well. And I know I reached out to Dawn Yohe to ask her the status, because I do remember in the the court requirements was that, if you'll remember, we had that original needs assessment that was completed by the contractor, and then the state plan that was done, that has to be updated periodically. And I know in talking to Dawn Yohe, she said that that has been started already at DHHS. This one will be more internally done by DHHS as opposed to having a contractor do it. So that is all due December of 2026. So while that likely won't help us for this year, that will give us some direction for the coming years with that update on the needs assessment and the state plan. So I just wanted to highlight that for other members. Anything else that people think of that maybe we've missed or maybe we need to add, or thoughts?
I don't have anything novel to add. I just agree. I put down the ACRN, but I guess it's FRN because it's the same thing. Particularly if we were going to discuss what some Medicaid budget cut impacts might be, I think that may very well be a recommendation to the ACRN or the FRN funding on how to maintain some status quo for some critical programming depending on outcomes.
Yeah, that's a great idea, I think. Anything else from the subcommittee members? The one thing I'll throw out here, it's kind of not a fully formed idea yet, but I did read an article about how California has implemented bridge programs in their emergency departments. And in the article that I read, it was talking about the increases they've seen in the prescribing of Suboxone specifically in the emergency departments in California since they've started that program. So that may be something, because I know that's something that we've looked at in the past and was in a recommendation. So if I can find that article and can find anybody that could present on that, I think that for me would be interesting to hear about.
I wonder if there's also data available, or if this would be a presentation from somebody in regards to our CCBHCs and what their MAT usage and, you know, access is looking like. Like, are they filling a gap there? What is, I don't even know.
Yeah, that's a really good point.
Christine Payson, for the record, can you define that acronym?
Yes, I'm so sorry. Speaking in alphabet soup there, the certified community behavioral health clinics are required to be providing substance misuse treatment, which includes medicated assisted treatment. And so, like I know my local CCBHC, that Certified Community Behavioral Health Center, does have Matt available. And I would just be really curious to see the access rates. And that may or may not need to come directly from them. They got to be reporting up to cassette, maybe. I don't know. Maybe it said their answer to someone somewhere.
Got it. Makes sense. Thanks for the clarification.
Yeah, I think those are good points as well. One thing, I know we had a presentation on it, it kind of affects the some of the recommendations that we've made or have supported from the regional behavioral health coordinators is the workforce issue. And I know that Dr. Hunt at UNLV has been working on that program. So that may not be specific to response, maybe. And I don't know if one of the other subcommittees would hear that, but or the larger surge, but that would be one that I would be interested in hearing. Have we started to see any, improvement, or is it too soon to tell and they're just really, putting the foundation in place? I'll give you guys a minute just to think if there's anything else that that comes to mind. If you don't think of anything now and you have that aha moment later, please feel free to email us and we can address that. If you brought up a recommendation and you do know of a speaker, let us know, or we can also start looking for those as well. Not seeing anyone go off mute. We can go to the next slide. So discussion on reporting out for the April 9th surge meeting. I think for this one, it's going to be pretty simplistic. It will really be, that we've reoriented. We went through and looked at the recommendations, looked at what our recommendations have hit on based off of that chart that or table that SEI made and the special populations. We talked about where we want to be, whether that's refining, bringing back previous recommendations and refining those, or getting new ones. And it's really going to depend on the status of where our recommendations are currently at. And that's all I have. Does somebody else have anything that I missed that I should be reporting out at the April 9th surge meeting?
Dr. Crystal Duarte, for the record, I was just going to note, did you want to get subcommittee input on the additional members presented on February 17th at the AB 19 hearing?
I do. Thank you for reminding me of that. So just by way of background, I think you all remember that AG Ford had a BDR to increase the membership of the surge, and there was a hearing on that on President's Day on February 17th. And what was included was a member of the general public, a member from Fire EMS, a member from DCFS or Foster Kinship, someone from the public defenders, from DIDS, and also from the prosecutors, the state prosecutors. In that hearing, and I think I alluded to this previously, I think some of the members were surprised that we wanted to increase membership. So I did go through the process, and that if we got too large, would we still be able to get done what we needed to get done? So I did address the process that we've used and all the things that we went through today about how we took the legislation and really kind of sliced and diced it and assigned it to the different subcommittees. And so I think that helped to align the fears. But we did have Cody Finney from DHHS who suggested someone from DPBH specifically to be on the subcommittee. So that's something that the AG's office will be in communications with them about. Because if we do end up getting somebody from DCFS, We also have Dr. Slamowitz from the director's office, and then from DPBH, is that going to be kind of top heavy with having 3 state employees from DHHS? So something we'll be able to update you on. There was also the Clark County Public Defender's Office wanted representation on the SURG. But I think the feel is on that is that perhaps the Clark County Public Defender's Office should be involved with the communications and the meetings for Clark County's opioid task force, so that they can make their recommendations to them specifically, because we're really looking more at that state level and the Fund for Resilient Nevada. So again, back and forth on that with it. And then one of the committee members made the recommendation of having, as opposed to just a member of the general public, having someone that's from a bilingual household that's affected by substance use. Because, you know, I know we've had some ad campaigns that haven't necessarily hit where they need to hit. So having a little more cultural competency in that area. So that's another area that we're looking at, whether that's a separate person or adding that in with just a member of the general public. So that was what the recommendations were. We also had people that recommend, you know, you have someone who is going through recovery, which we already have on the committee. You know, somebody who treats people with substance use disorder, which we already have that on the committee. So the ones that we already had, we noted that we already have those on the committee. I did highlight also that we have both the SURG and the ACRN, which Dr. Holmes commented on. And there is some similar membership in both of those, but also some different membership on both of those. So looking at the membership of both, I would highlight that not all of the members it was the HHS Subcommittee for Legislation. Not all of them had seen our recommendations, so they wanted to see our recommendations. So we did let them know that we had already sent it to LCB and that they had access to it. So many of those members will be looking at our 2024 annual report to see what our recommendations were in the membership of the SURG. So just to let you know, I know that AG Ford did say to the committee that he wanted to have this voted on. So at the April 9th meeting, this is something we will be voting on. So I just wanted to highlight all of that for the subcommittee members, so you'll be prepared for that in the April 9th meeting when it comes up. Any questions or comments?
My only comment would be in regards to that request from DPPH to have representation. They have the oversight of the ACRN, and they have the oversight and discretion of the funding. So I agree that it would be a bit top heavy to also have additional representation as a general DPPH individual on the SURG. I think DCFS is super important because they are a part of our target populations that we are specifically looking at. I think if there was specific representation from a state entity because they meet one of those specific needs, it would make more sense, but it feels as though it would be a bit unbalanced to have them overseeing the ACRN, overseeing the FRN funding, and then also being a voting member of the SURG.
Yeah, that's a very good point. Thank you for highlighting that about their oversight over the ACRN and also our management over the FRN. So good points. The one thing I would highlight is I know that Dr. Slamowitz out of the director's office doesn't have the same depth that we've seen in the representation when we had Dr. Woodard, who was intimately involved with the DPPH. So I felt like we had a little more input from her on, you know, for example, when there's programs that are already being funded that we're looking and talking about funding, but that's something, if they're not on the committee, we can reach back out to them and get their input. But, you know, I think it's gonna be going back to Cody Finney and seeing who the director, because the director does get to assign someone, whether that should continue to be Dr. Samowitz or someone from DPBH. Okay, I think we've hit all of the discussion points for item number 7. We are now to the point of public comment again. As before, all the same things. That you can make public comment by raising your hand or on Zoom or on meeting, or if you need to call in, the phone numbers are still the same, 669-444-9171. Enter that meeting ID 868-3331-1069, and then press *6. Anyone for public comment? I don't see anyone. I'll give it just a little longer to see if someone's trying to unmute or call in. Do you see anyone, Crystal?
I do not see anybody coming off of mute or raising their hand.
Okay, we'll move on to the next agenda item, which is agenda item number 9, which is adjournment. Not quite, but we got through this meeting in record time, so we'll be giving you back just about a half an hour to your day. Thank you, committee members. I look forward to working with you again this year. You've been very dynamic and very participative, so I really appreciate that. And the meeting is adjourned. Thank you. Bye, everyone.